Salve, buongiorno a tutti. Aspettiamo la dottoressa Heidarian per iniziare. Buongiorno. Vediamo se si connette la dottoressa. Abbiamo mandato l'invito. Ciao Arianna. Si sente la mia voce? Buongiorno a tutti. Stiamo aspettando la dottoressa Heidarian. We are waiting for Dr. Heidarian from Iran. Thanks for telling me that my voice is... Here we have. Doctor should be able to connect right now. Thanks for... Hi, good afternoon.
Hi.
Good evening.
Hi, how are you doing? Nice to see you here.
I'm good, thanks. How about you?
I'm fine, thank you.
Very well, very well. Okay.
Thank you for the invitation. Yeah.
Thanks a lot for accepting our interview here, our call. We have some people connecting. You are a very famous doctor in Iran and also in some other countries. You've been talking, I know, in Turkey, and I know there are some doctors in Turkey. They know you very well as well. But maybe you can tell us a little bit about you, introduce for all the other people
Surely.
who didn't have time yet to meet you or to listen to you.
First of all, I just want to make sure if my voice is okay. Can you hear me? Do you hear
Yes.
me? Is that okay?
Yes, I can hear you.
Okay. Okay. Yeah, okay. Do you want me to introduce myself?
Yeah.
Yeah. Okay. Thank you for inviting me again. Please allow me first to introduce myself to those who don't know me. My name is Dr. Mernoosh Heidarian, board-certified dermatologist.
Sorry, maybe we've lost the... Something happened. We've lost the doctor. I hope she can reconnect. Anyhow, in the meantime, I ask anybody who might have some question for Dr. Heidarian to write the questions in the chat here, so we can read them to her and eventually she can answer. Let's see if she can come back online. Here she is. Sorry for the technical interruption. She is connecting again and she will be online soon. Here we go.
Yeah, I come back. Sorry for this connection. It was a poor connection here. I'm so sorry.
No problem.
Okay. Where were we? I was introducing myself. My name is Dr. Mernoosh Heidarian, board-certified dermatologist from Iran, and I've got my own practice in cosmetic dermatology in Tehran. I've been lucky enough to be joined to Dr. Paulo from Eufoton company today, and I'm here today to be sharing with you all my experiences in regard to Endolift. Actually, I'm KOL, or key opinion leader, for Endolift among dermatologists in Iran. And since field of my interest is cosmetic dermatology, I started performing this procedure on my patients about 3 years ago. And you are not going to believe that, but it's become a major part of my practice in the last couple of years. And I have done successfully on maybe more than 400 cases so far. And I assure you, most of my patients are happy with the results. And even some of my patients ended up with remarkable and significant results in terms of skin laxity treatment and face sculpting or face shaping, and even in acne scar revision.
Oh, fantastic.
You're welcome.
Let me try to ask you something, because you are a super experienced doctor in this technique.
Thank you. That's very nice of you.
But maybe somebody on the audience is not very familiar with what is Endolift. Can you tell us a little bit more about what is Endolift?
Surely. Sure, for sure. Endolift is a new technique in aesthetic medicine. It's the new office-based, outpatient, minimal invasive procedure of laser interstitial lifting. It doesn't require any anesthesia, no incision, and the recovery time is almost zero. It takes advantages of some optical fiber, with the size of like 200 or 300 micron diameter, which inserted through deep dermis or superficial hypodermis. What the microfiber does is delivering the energy of laser from device directly underneath the skin. And, it uses a Eufoton innovative laser called LASEmaR 1500, which is certified and approved by FDA in laser-assisted liposuction. It's a new technology which is very safe and effective as an anti-aging therapy. To me, I call this method like a miracle non-surgical facelift, because the patient with minimal pain got the maximum gain. No injectable, no Botox, no filler, or no thread involved. It's all about your body's own collagen and elastin, which turn back the clock on your aging. Okay.
Thanks
for that. And you could apply this procedure on face and body, and as I have said before, no anesthesia required. The recovery time is almost zero. Most of the time, one session is enough, and you can combine this procedure with other cosmetic procedure to enhance the result.
Okay. In the meantime, I'm reading the messages below. Somebody's writing, you are the best doctor, so you have a
I'm so happy to hear that. Thank you.
Okay, let me ask you another question. Let's say I am a patient. What are the characteristics of the best candidate patient? So, which patient would you recommend to do Endolift as a first choice?
I know. When it comes to aesthetic procedure, any kind of aesthetic procedure, you should be very careful to choose the best candidate if you want to end up with a great outcome. And that's the same for Endolift laser. The best candidate is those people who are in middle age with thin skin and slim face, and those people who's got the initial sign of skin aging, like nasolabial, like a nasolabial folds, marionette lines, or trigels. Then they are noticeable, and the person is in their middle age with thin skin, no fat, and a slim face. They are the best candidate. Conversely, the poor candidate are those people in their 60s or 70s, elderly people with heavy jawline and chubby face, thick skin, and a lot of fat in the face.
Okay. I saw also in the meantime a lot of hearts coming from the right, so people are very happy. Another question. So, okay, so the patient are in the middle age, might have a laxity or fat deposit to be removed. So, which are the areas you treat the most in the face?
The people with muscular laxity are not a good candidate. Right. You better go for the people in their middle age, like I said before, slim face, thin skin, and no fat. They are the best candidate. And in the face, you're allowed to do Endolift laser in the area like mid face, lower face, mandibular area, under chin, and on the neck, or even on upper lip and under eye.
Mm-hmm. Have you treated also some area in the body?
I have never experienced on the body. All my experiences are on face, especially in skin laxity treatment and face sculpting, and even in acne scar revision. I'm going to show you some before and after photos of my patients in my private practice, and you see the the difference between before and after picture, especially in acne scar revision, which is very unique. I'm trying to collect some database information to publish an article, in regard to laser-assisted subcision in acne scar revision.
This is a next question I want to ask you, because we know not only you have a great experience in the Endolift, let's say we call it traditional treatment, the treatment we develop in Europe, but also you are bringing your experience and your knowledge to different, slightly different areas. In particular, yes, I've been told about your study and future publication in acne. Mm-hmm. So I'm really, really curious to know more about this, or if you want to show picture before.
Yeah. Do you want me to show you some picture right now?
Absolutely, yes.
Yeah. Okay. Let me. There's a numerous. There is a numerous clinical application with this laser, and this is one of my favorite procedures in aesthetic medicine, because in dermatology and in plastic surgery, you can use it in different ways. Like I said, in skin laxity treatment, in face sculpting, acne scar revision, in treatment of fat transfer complication, like those people who ended up with puffy face, uneven surfaces, or asymmetric after fat transfer, and in treatment of granuloma caused by filler injection. There are numerous clinical application which make this procedure versatile and multipotential, and that's very cost benefit for end user. Okay, let me find some pictures. Let me flip the video first. Okay.
In the meantime, I saw a question by Somi. Is the Endolift useful for the whole face or just some parts? Maybe I can even answer this because the doctor discussed it before. So the area where the maybe she will also show now the picture.
Okay. Okay, this lady was one of my patients who was in her late 50s, and he came to my office for treatment of skin laxity. And as you see, there is a deep nasolabial fold here, and initial sign of marionette line here, and the double chin. And the jawline is undefined. And this is what happened 6 months later.
Okay.
This is what happens 6 months later. It's like, go ahead.
I think it's a little bit dark. Maybe you should try to tilt the screen a little bit. Tilt in the direction of the... Let me turn around the laptop, maybe. What about right now? The upper part is okay, but the lower part is a little bit dark. And I think maybe it's because of the reflection. So maybe you can try to put the screen more vertical. Apparently there is like a big light on your back, and it's reflected on the screen.
Let me see.
This anyhow, this technology is really something.
Yeah. Does it work? What about now?
A bit better.
Can you see?
Mm-hmm.
Is that noticeable or not?
Yes, a little bit more visible now. The left part, I think, is very clear. The lower part, the right part is a little bit dark.
Let me change the direction of the laptop. Maybe it works here. And what about now?
I think it's more evident now. I can see better.
Yeah.
Maybe it's me a little bit blinded, but.
Yeah. Okay. This lady was in her late 50s, and she came to my office for a scalactic treatment. And as you see, she got the deep nasolabial fold, deep marionette line, and undefined jawline, and the double chin. And this is what happened 6 months later. Now, she looks so younger, refreshed, and useful. Very well defined jawline, more prominent cheekbone, and the nasolabial fold and the marionette line is almost gone, and the double chin is removed. It disappeared. Yeah. That's a huge difference, It's a huge difference for one single treatment.
Yeah.
And you should consider, go ahead.
Somebody indeed asked how many sessions to achieve this result.
It depends on the case. You can. I told you, if you choose the best candidate, most of the time 1 session is enough. But it depends on the case, and each treatment should be customized depending on patient characteristics, including. Let me see. Including general skin condition and skin thickness, amount of fat, and degree of laxity. What I'm doing is that, after 6 months, I ask the patient to come to my office to re-examine and reassess the patient. And if necessary, I should go for the next session. It depends on the patient. But I told you, most of the time, if you go for the best candidate, 1 session is enough.
Okay. I'm sorry for the friends that writes in Farsi. I'm not really able to understand the question. For somebody asking about bibliography, about the Endolift, I think the best is to contact Miss Arianna, info@eufoton.it, and they can provide you bibliography. Somebody asks a little bit about parameters. I might want to answer that because parameters are generally preset in the machine, so that's the starting point. So this is another case, Doctor? This is another case. This lady was in her late 30s, and she came to my office for face sculpting, face shaping. And as you notice, the jawline is very well defined, and the double chin is removed, and the nasolabial fold and marionette line disappear. She was young, but in this picture, she looked more refreshed and useful. This is another, clinical application in the Endolift procedure, because she's not that old, but she came to my office and second for face shaping. And this is what happened after 6 months. Okay, so there's a question, how long does it take to see the results? This is a complex...
6 months, I told you 6 months. There's one thing I should talk about. Let me flip the video. In this procedure, I recommend you always talk to your patient and consult your patient properly and discuss everything, including the outcome, the expected outcome, and the journey you're going to take. Because it takes time to get the best result, final result. Maybe it takes up to 6 months to obtain the final result. It's different than other procedures like injectables, like filler or Botox or thread, where they've got an immediate result, and you can see the final result maybe in a few days. But in this procedure, your body is healing. Your body start collagen formation, which takes time. Then you have to wait. You have to make them understand that they have to wait until to obtain the best result.
Okay, that's good. That's correct.
But the beauty of this procedure is that the result is long-lasting compared to Botox or filler. Is long-lasting. When it comes to injectables, you have to redone it after within 6 months or 9 months. But with this procedure, the result is long-lasting, and the outcome is very important. It's an important role in every outcome, in any outcome in any cosmetic procedure.
Okay, I have some questions they have been asked by the audience. One question is about side effects.
Okay. Let me change my position here because I have to, hold it in my hand is hard. Let me change it.
In the meantime, I can also tell you that you have patients writing that they have tried Endolift by you, and it was excellent. So you have a lot of hearts and a lot of compliments.
Thank you.
I repeat, I'm able to answer or to read the person writing in Farsi or just let me say one thing. Maybe all this person can contact the company, Shepco. They can answer, or the doctor eventually. Sorry.
No, that's okay. The possible complication in this procedure is they are all temporary. They are not permanent. But the possible complication are erythema or redness, swelling, paresthesia, numbness, or maybe a little pain during the procedure, and neuropyrexia, which happens very, very rarely. If you avoid the danger area and mark the danger area, you can avoid any complication. The only complication of this procedure is frustrating is neuropyrexia. It maybe takes a few weeks or up to 2 months to recover. And if you avoid the danger area and don't leave any damages to major vessels or the motor nerves, you can avoid any complications. But even neuropyrexia is temporary. It's not going to last forever.
Mm-hmm. So there are no, let's say, long-lasting side effects, and normally the procedure is done without any kind of complication, and also the downtime normally is very, very.
The recovery time, the downtime is almost zero, and and all the complications, the possible complications I said are temporary; they are not permanent. And if you avoid the danger area, nothing happened. And if it happened, it's temporary. But I recommend you for the beginners. Just go through the anatomy, review the anatomy before they go performing this laser. And all the time, as a physician, do the procedure by your own. Don't ask anybody else, like nurse or technician or operator, to get it for you, because it's a minimal invasive, procedure, and you can you better do it by yourself. And if you do it by yourself, you avoid any complications, and plus, you build a trust between your patient and yourself.
Mm-hmm. I have another question about dose of energy. Maybe this one I answer very briefly, because dose of energy is not a clinical endpoint. Is normally depending on the patient, is never probably exactly the same.
No, yeah, exactly. Yeah, the treatment should be customized on each patient and depends on patient characteristics, including general skin condition, skin thickness, the amount of fat, and the degree of skin laxity. There is a manual instruction in the device with the preset, presetting files. But like any other, new cosmetic procedure, when it comes to practicing and performing, the less is more. Just be very conservative and stick, follow the instruction book. But as I told you, the less is more, because maybe you go wrong, even with instruction book, because I told you the treatment should be customized on each patient, and clinical endpoint is much more reliable than dual basis.
Absolutely.
Endpoint.
Absolutely.
Yeah.
This is the experience we've collected also in our experience when we.
I always say that it's like a cooking. When you go for cook a new dish, first you go, you follow the recipe, but after a while you gain your own experience, and you have your own recipe.
Exactly.
And with the same recipe, all the dishes taste different. They don't taste the same. That's because of the chef. And that's why I'm recommending the physician do it by themselves. Don't ask anybody else to do it.
Yes, exactly.
If you want to get the best result, if you want to build the trust with your patient, and if you want to avoid any complication, if you want to keep your reputation, just do it by yourself.
Very good suggestion. I have another question I signed. It's somebody was asking the difference between Endolift and I think monopolar radiofrequency, if I read correctly.
No, it's totally different. They both are energy-based devices. But the energy in Endolift is laser. The wavelength of laser in Endolift is 1470 nanometer, which is diode, and this wavelength is the gold standard wavelength for fat and water absorption. And the laser is totally different than radio frequency. They are both energy device, but with different kind of source of energy. And also, Endolift laser is a minimal invasive laser, which means that it works directly on the target. Mm-hmm. Based on selective photothermolysis. In radio frequency, there's no selective thermolysis. There is no specific target.
Yes, correct. Yeah. Thank you for answering. Sorry, but there are so many questions.
Yeah, I'm here. I love to hear their comments and answer any question. That's why I'm here.
To catch them all. Another question is, do you use compression garments after the treatment or no?
Yes, I do. Because of the swelling, it helps the swelling is gone, very fast. Help the lymphatic drainage works better, and the swelling is gone faster.
Have you experienced, or is there the possibility of having scars, I guess, in the entry point of the fiber?
No way. Actually, there is two different optic fiber, linear and radial. The radial one is the latest one, the newest one, and it's got the sharp tip. And it doesn't require to make any incision, but maybe in some patient with thick skin, you possibly need a needle with gauge 25, just poke or puncture the skin and just go through the skin with the fiber. No incision, no stitches, or even no anesthesia is needed, and then no scars left.
Do you use cooling?
Yes. Air cooling is the only way to numb the treated area, and it also helps to control the temperature. You shouldn't let the temperature exceed 40 centigrade. Then you have to control the temperature with the infrared temperature, or even pause the treatment, apply skin cooling or air cooling in the meanwhile.
Okay. Another question was about, let's say, one patient with preposition for keloid. Do you think they are treatable, or better to avoid when they...
I have never experienced with keloid. I have never experienced with that, but it could help. But like any other keloids, there is single therapy is not enough. It's not working. You have to use the combination therapy. But in depressed acne scar, I told you I've got a lot of experiences. I'm going to show you some different after picture of my patients who are suffering from disfiguring acne scar, and it really worked on those patients.
There is another question about possible of pigmentation after treatment.
No pigmentation, because it's not going to work on the epiderm, on the superficial layer. It's, the plane we're working is somewhere between deep dermis and superficial hypodermis. Then there's nothing to do with epidermis. Then post-inflammatory hyperpigmentation doesn't occur, after this procedure. And this is a beauty of this procedure, because the recovery time and downtime is almost zero. No pigmentation, no burning, no erythema. Maybe there's only a little bit swelling, which it's gone after a couple of days. Absolutely.
We have also no experience of. In our records, we take notes of all the other doctors. If they have some problems, they might contact us, but nobody never contact us about the risk of pigmentation, because, as you say, there is no damage on the surface.
And that's why you can perform this procedure all year round, even in the middle of the summer. Because there's no wound or no injury on the surface. And there's nothing to worry about the post-inflammatory hyperpigmentation. You can perform this all year round, even in the middle of the summer.
Okay, I have two questions. Honestly, one is about a patient with lupus, another is patient that is diabetic. Do you think they are treatable, non-treatable? Do you have experience? Does it happen to you?
I usually reject those patients. There's some contraindications for this procedure, like diabetes, the patient under treatment with immunosuppressive medication, or photoallergy, connective tissue disease like lupus and photoallergy, or any infection or swelling in treated area. They are all contraindication for this procedure.
Absolutely. Also, we avoid in our guideline during pregnancy to normally, but not an absolute contraindication. Another question, I guess you might have had experience to combine with Botox?
Yes, I do. You can combine this.
To Endolift before or after the Botox?
Now, I prefer go for the Endolift first and then add Botox, because of the edema or swelling. Maybe the Botox is diffusing. And that's what I'm doing. I'm going to show you some combination therapy in my patients, to show you some picture of my patients with combination therapy, including Endolift, Botox, filler, and there is a makeover, like a huge makeover for the patient with the combination therapy.
Also, sometimes we've been asked if you combine with filler, and also there if you do first filler or first Endolift. I think the answer is always the same. First,
that's the same. I prefer go Endolift first, and just wait until the Endolift works. And then go for the filler, because when you go for the Endolift, you got some lifting, some skin tightening. Then you need less filler. Filler injection got lifting, but as a when you go for the lifting with filler injection, maybe you overfill the patient, which ended up with the unnatural look. Then I prefer go for Endolift first and wait until to see the initial sign of the Endolift worked, which takes maybe 3 months, and then go for filler injection as a final, touch, as a finishing touch.
Okay. There is a question from Arya Soleimani. If you want to treat 3 kinds of pathology, laxity, lifting, fat and acne scar, which one of them need more energy? I think it's the same answer of before.
No, that's the same answer, yeah.
It's very difficult to give universal doses. It's very, very complicated.
Yeah.
I think somebody also asked about the treatment around the eyes. What can you tell us about the periocular
under eye? I personally prefer not to do that in that area because I have no experience in under area, and I got a lot of experience in mid face, in lower face, mandibular area, and neck, but not in the lower lid area.
Okay, so can you tell us now a little bit more about this acne scar?
Acne scar? Okay, I'm going to show you some pictures.
Something.
Yeah, sure. Just wait a minute. Okay.
If I have missed some question, let me know. So many hearts, so many appreciation for the picture as well, I think.
Yeah, this is before and this is after. Can you see the difference?
Yes.
Can you see the difference?
Definitely.
Yeah.
For me, it's very clear. There is a before and an after with a lot of difference.
There's a huge difference. After one single treatment, Subcision with Endolift. I call this method like a laser-assisted Subcision. And I'm going to show you the second one. This is before. And this is what happened 6 months later after one single treatment of Endolift laser.
Mm-hmm. Wow.
This is a nice lady, one of my patients who was suffering from disfiguring severe acne scar, which was very extensive, including temple area, vocal, jawline, and even the neck. And this is what happened after one single, treatment with no recovery time, no wounding, no injury, no PIH, nothing. They went through different modality of treatment in acne scar, and she was unhappy. And when she came to my office, she was so disparate. And this is what happened after one single session.
One session?
Yeah, one session.
Okay, wow. Yeah.
And there is more. This is another one. This is a young lady, again, suffering from severe acne scar with different types. As you see, linear, round, box scar. There are all types of acne scar on her cheeks.
Mm-hmm.
And this is after 6 months. The appearance of the scars is better. Is smooth out the overlaying skin on the scars.
Yeah, it's very clear. I think even though the quality of this broadcasting is a little bit low, but I hope everybody can see and appreciate. From here, it's very, very clear.
You can tell even with this darkness, you can tell the difference.
Yes, I think also the people are making sign, okay, good, and sending hearts. So I think it's
This is
wow.
This is a severe disfiguring acne scar. It's linear,
Is the
and
same
this is what.
Left and right side?
Yeah, exactly. And this is combination therapy for, I use combination therapy for this patient. I just did one session Endolift laser for subcision. And after a few months, I did full beam resurfacing laser. And the erythema is because of the resurfacing laser. And there's a huge difference.
Absolutely. I'm reading now questions about acne scars. Sorry for the other questions about lipo, but I think we can eventually do it in another time because there's so many questions. Somebody is asking, how soon would you apply a chemical peel? Somebody is asking a lot of about a retinol product same time also.
Let me explain first about Subcision. Just go through very briefly about what Subcision like and what is it. As you know, Subcision is a small surgery, outpatient small surgery in acne scar treatment. In old technique, we use hypodermic needle like no-core needle or cannula to cut or break through the fibrotic strands or fibrotic bands at the bottom of the scar. The scars with round shape or rolling scar with gently sloped edges are the best one to respond to Subcision. In older techniques, we use the cannula or the needles on each or in every single, scars. We need anesthesia, and it's very common to experience swelling and erythema or redness. Maybe it takes up to 7 days to recover. It got a recovery time. And, when you cut through the fibrotic bands, which pull the skin downwards and make indentation and depression on the surface, by releasing the fibrotic bands, the skin lifts up. Then the appearance of the scar looks better. That's what happened through normal and older technique of Subcision. But about the new technique, which I called laser-assisted Subcision, I use Endolift technique. And what it does is just break through the fibrotic bands or bonds or the tetra bonds at the bottom of the scar very easily because we are using an energy-based device. Then you need less number of sessions. It's not like the former ones. You use the needle and physically rupture the bonds. But in this technique, you use the energy device. Then it's easily done, broken. And the number of sessions you need is less. And plus, the laser additionally works. It stimulates collagen formation, which means that it takes time, maybe up to 6 months. It gradually works and it's getting better and better. And after 6 months, you see the final results. That's what's not happening in older technique. And that's the beauty of this technique. And plus, the recovery time is almost zero. No bruising, no erythema, or no edema. And in older techniques, you need anesthesia, and it could be very painful because I told you, you have to work on every single scars, one by one. But in this technique, you use the optical fiber and cover a big area as a treated area.
Okay. Yes. Interesting. I have a question. Do you use sometimes the light scan?
Not exactly light scan, but I combine. I told you I combine this. I combine this Endolift laser or laser-assisted Subcision with other procedure at the same session, like light scan, like radio frequency. You can combine this with other procedures at the same session, but not filler or Botox at the same session.
Right. Okay.
Yeah.
And for acne also, it happened, you combine or do only...
Yes, of course. Yeah, yes, of course. I already show you the one.
Okay.
The last one I showed you, it was a combination therapy, including a laser-assisted subcision plus full beam resurfacing laser. It was a Erbium React full beam laser.
Fantastic.
Yeah.
So we are looking forward to see some publication and to discuss more.
Yeah.
With not in front of.
Thank you.
Okay. I don't know if I missed some question or if you want to tell us something more that you think it's important that we miss or that you want to.
I don't know what I would like to hear the audience comments and answer any questions.
Okay. There is a question now about fat transfer that it was not good. How does it work? But I think it's not relevant about fat transfer. I don't think it's relevant to Endolift.
No. Maybe it was a misunderstanding because I already said that you can use Endolift laser to treat fat transfer complications. Those people who already got fat transfer and ended up with complications like asymmetry on the face or uneven surfaces or puffy faces. I've got some picture of those patients as well. If you want me, I can show you.
Absolutely. I think it's... I personally think a picture speaks more than 100 words.
Yeah, so the picture speaks for themselves. Yeah. Okay, wait a minute. I'm going to show you the one with fat transfer complication. Here.
And other treatment is about also, I think, complication of filler and granuloma, right?
Yes. You can use similar. This is a nice lady. She had fat transfer. She had maybe 5 years ago, and she was unhappy with the puffy face due to fat transfer, and she's out like 6 months from one single session Endolift. Yeah.
Absolutely.
When it comes to treatment of fat transfer complication, you have to focus more on fat melting. I remember to tell you one thing, about Subcision. When it comes to treat acne scar treatment with laser-assisted Subcision, you have to focus solely on skin tightening, not fat melting, because we need the fat compartment to support the acne scar. And if you lose the fat, and the fat melts, it loses the support, and maybe it looks worse. Then just focus solely on skin tightening when it comes to acne scar revision. But in those patients, I show the picture in treatment of fat transfer complication, you have to focus more on fat melting, which means that you have to play the setting. To get the different results.
Yeah, absolutely. Very clear, I think. Unfortunately, as said, I'm not really able to answer or read the question made in
Farsi. Yeah.
In Farsi.
Yeah.
But we appreciate the question. About other things, so another question sometimes I've been asked is if the procedure can be redone, and if yes, after how much time? Speaking about Endolift for acne, for instance, might be acne scars.
It depends on the case. Something between 3 months to 6 months. I personally prefer 6 months to see the final result and then reassess reassess or re-examine the patient and then decide go for the next session or for another procedure to combine.
Absolutely. Okay. Well,
but the initial sign of the result happen after 3 months. But the final results just takes maybe 6 months. That's why I prefer to wait for 6 months and then decide.
Exactly. Yeah. After 6 months is the time, the effect of the collagen. There is the regeneration.
Yeah, exactly.
Place, in a more defined way. Before it's all work in progress. You give the contraction, you enhance some biological process to start, and then this complete after some times. It's a work in progress.
Yeah. The laser works in three ways, in multiple purposes. One is remodeling of collagen in both superficial and deep layer of dermis. Number 2 is stimulation of collagen production or no collagenesis. And 3 is reduction of the size of unnecessary fat or unwanted pocket of fat, which could be used in treatment of fat transfer complication or in face shaping or in double chin removal. And that's the beauty of this procedure. I love it because it's very multipotential. And if you compare this, this procedure to other procedure like injectables, like Botox or filler, you get the immediate result. This procedure takes time, but it lasts longer, and the longevity is a very important role in any outcome in a cosmetic procedure. When you compare this with big surgeries like facelift, you don't need to expose yourself to complication of big surgery like facelift or undergo general anesthesia. In this procedure, it doesn't require any anesthesia, only air cooling applied, and plus the expense is not comparable to facelift. Is much more affordable, a very, very cost benefit for patients.
On this regard, let me read you this question from Aria Soleimani again. I'm anesthetist. I do Endolift with face nerve blocks. I combine it with LPG for 6 sessions once every week. Started 3 days after procedure. I think it can decrease swelling, pain, and edema clearly and increase result. So I think the question is about what do you think about his protocol, because this is clearly its own, as you said before, recipe.
I'm just lost with you. She was talking about injection for anesthesia, like a nerve block.
He do nerve block, and then it combines.
Nerve block. No, I don't recommend even nerve block or injection. That's because I told you that if you inject lidocaine, you're going to get into trouble because the target, I told you, the chromophore in Endolift laser is water and fat. And if you inject lidocaine, you're going to waste the energy because instead of absorbing the water in the tissue, laser absorbed by the water in lidocaine, which means that the laser is not going to work. It's not going to working. And plus, the pain of the little pain of the patient during the treatment is like a guide for you. It helps you to avoid the danger area and then avoid any complication like neuropaxia, which is very frustrating for the patient and for the doctor. Then I don't recommend any anesthesia like lidocaine injection or nerve block. If the patient is very sensitive, you can apply just topical anesthetic cream like lidocaine plus prilocaine, to numb the area, just the topical cream.
In our experience, the treatment has been studied to be as painless as possible, so it doesn't require particular anesthesia or particular downtime. We never saw a relation like if you do the double of the pain, you have the double of the result. It's not. It's not like that.
No.
Somebody
just air cooling, putting the ice back. Putting the ice back, and air cooling is enough. You don't need any, injection or nerve block. for this procedure. And that's the beauty of this, yes.
Somebody's asking use of Endolift in the nose area.
Nose area?
Nose area.
No, you're not allowed to do that in forehead or in the nose. No.
All right. Okay. And I think there was another question. Yes, somebody is telling me, tell Dr. Eufoton to speak Persian. I wish I speak in Persian, but not so good. I think we have 5 minutes to before, because this direct only lasts 1 hour after automatically stop.
Okay.
And then there's no way to continue. So I just want to say that this direct live will be available on our website, Eufoton, Instagram, for 24 hours. So if somebody want to see it again, can see it there. And I don't know if you have something you want to add. Otherwise, it's time to say happy quarantine, happy continuation of.
Yeah. I hope this crisis is going to be over very soon, and I see you again. I can see you again in this Congress.
Yes, exactly. See.
Yeah.
But thanks, really, thanks a lot for sharing your experience. It was.
You're welcome. Thank you for inviting me.
Formative, and hope to maybe, if we have time, to do another time or organize.
Yeah, it's my pleasure.
Okay.
Thank you.
Thank you very much.
Thank you.
Bye.
Bye. Have a nice day.
Yeah, you too.
Bye, everybody.